Hi, my name is Dr. Jimmy Hang. I'm a physical therapist from Total Body Center in Alhambra, California. I'm here to demonstrate to you a proper sitting posture and pain relief. And right now I have Chelsea here to demonstrate what a poor sitting posture is. Now as you can see, if someone's tall or someone's heavy set from the top, and if they sit for a long period of time, let's say for 8 hours, they tend to slouch and their head is much more forward, and typically they normally get like headaches and strain on the back. And just to show you how the gravity acts on their spine if you sit for prolonged periods of time, this is what happened is she started bending at the weaker points of her body. Okay, now if I position her in a neutral spine position, keep your head up, tuck your chin in, hold your stomach tight, keep your core tight. This should be a neutral position. So if she's in this position, when I push down into onto your shoulder, she's more stacked up nicely within the spine, and she doesn't bend as much. So this is what we call neutral spine position. This is our normal curvature, and as you can see here, we're born with a nice curvature, acts as a shock absorption. And what's helped as a shock absorption is the disc in between our vertebral bodies. And if we're in a poor sitting posture for long periods of time, our back is usually like this, flat. And if we constantly in this position, what happened, we have degeneration, and that's where we have a disc bulge, and we have numbness and tingling into your legs, and people call it sciatica. But if we keep ourselves in neutral position, in a neutral spine, and where the vertebral body is stacked nicely, accordingly vertically, then we don't have that weakness in the spot, a degeneration of our back. So now let's go back to Chelsea here. Now she is in this neutral position, but obviously no one could sit in this position for prolonged periods of time and need some kind of external force to support her in this position. Otherwise her back's going to be hurting and not able to hold this position for a long time. So what I suggest for you, you could do this at home. Get a bunch of towels or pillow, set it underneath, so where her hip is angled above her knee, so that you're having your back extended into a neutral position and not round like this. And you notice a gap here? So again, she cannot have her back like that. So if she, at the end of the day, she's still going to be slouched underneath and then still have a strain, so you need to support the gap here. So you could use any masking tape. Tape it around. As a lumbar roll. Any type of towel. And you place it here. And she is resting her body into this position. And she don't have to fire all her muscles. And she's in a resting position. The only thing is for the lumbar support and the towel is you can't always carry this. And it's sometimes cumbersome to make. And we do recommend a lumbar roll that we also sell here. So if this is not what you want to do to create for a towel, because what it is, you can't interchange this from a desk to your a car and a car seat. So this you could change it into your car seat. So this, a lumbar roll, there's a strap. You strap it over the chair. Or if it's a car, you can strap over to the car seat as well. Again, she could rest her position here. But we haven't still solved this position of where her hip should be above her knee. So with that, you have to purchase a chair that gives you that option to put you in the angle so where your hip is above the knee so that you're closer to the neutral spine position. And another alternative we have here, so that you don't have to use this towel, all these towels here, then you look silly like you're always going to go to the beach, that you have to carry that around. It's just one couch. It's called a Nada chair that you could also use it to create a neutral spine position. So if you could come here and take a look how this is arranged. See, this wraps over her knee. Let's make this loose so she can cinch it later. Yeah. So there's padding where her knee is attached. So the whole idea and the concept, go ahead and cinch it up. So she cinches that and she clips this in. And then go ahead and angle it from the side. So from here you can see that as she cinches, go ahead and cinch again. As she cinches, this push her spine into this neutral curvature of her spine, and she don't have to fire all her muscles right now. So she's resting in this position. And her knee is locked, everything's locked, so if she's here working on her desk 8 to 12 hours a day, she could handle that. So everything is neutral, so if even when I do this, she's nice and stiff. She doesn't bend where the weak spots are. And she don't develop a degeneration of her spine, getting sciatica, numbness, tingling, and all that. But this, again, only limit to an hour at a time, I suggest, because if you do have knee pain, or knee patellar dysfunction, or patellar tendonitis, having this position to prolonged period of time, it's not going to be comfortable person with a knee problem because it puts you in a constant knee flexion. So I recommend this, just keep this on for an hour and unbuckle, stand, walk around, and move around, okay? So that's that, and if you have further questions, you could go on our website at www.totalbodycenterpt.com or give us a call at 626-282-1988 if you would like to purchase our knotted chair or one of our lumbar rolls. And always remember, surgery is your last resort. Thank you for watching.